Good morning. Thank you for allowing to present really two projects because they are combined in this presentation with the wastewater as sentinels for the spread of infectious diseases and the control of antibiotic resistance. This method has a long history, really, because it started in 1939 with the first detection of polioviruses in sewages, and then in 2003 this method was established by WHO as a surveillance system for the polio eradication. And during many years, single studies for chemicals and microbial pathogens detection have been carried out with this method. But it happens that in 2020, with the first detection of SARS-CoV-2 in sewages and its surveillance starting in many countries, this methodology became very popular. And now it is considered an essential tool for the preparedness and prevention against viral infections and antimicrobial resistance. In 2024, a global consortium on wastewater and environmental surveillance for public health has been launched at European level, but it includes also worldwide institutions. If you like, you can see at this site the Observatory for Public Health of Wastewater. Which is the added value for public health of wastewater-based epidemiology? Is the possibility of have collective data, anonymous data, and it is very acceptable and low cost because it does not need the analysis of people samples. It can detect epidemic spread and pathogen circulation, with also asymptomatic infections and non-tested people in context where it is not possible to analyze people. It is also important for early warning because people shed viruses in their feces before the onset of symptoms. It can follow variants and subvariants and predict the trend of the infection applying epidemiological models and also to allow the policy assessment with retrospective studies. The application, as I said, are for the search of chemicals, but now I'm speaking about infectious agents, and in particular viral infections and antibiotic-resistant genes. The levels of application of this epidemiology are cities at a large level, but also neighborhoods and individual communities. So this communication is about, as I said before, two projects. One is related to individual communities, and the other one, led by the Professor Claudio Lubello, that will speak later, is about the cities, a large place. So the project about community level is the name is Integrated Environmental and Clinical Surveillance for the Prevention of Acute Respiratory Infections in Indoor Environments and Vulnerable Communities. And these communities are a nursing home in Pisa and a prison in Lucca. The project is organized in different phases. The first one is the risk assessment to understand the adoption of preventive measures in these settings. And then there is the early warning part that I am describing here about the detection of different viruses, SARS-CoV-2, adenovirus, respiratory syncytial virus and influenza virus in sewages of these communities, to reinforce preventive measures. At this point, already in these sewages, we find the virus, but we can try to have an early warning and to have a reinforcement of preventive measures before the outbreak occurs. These are the data of the first year of the project. On the top, you can see the community level sewage monitoring. At the lower level, you can see the sewage analysis in the same city of the nursing home. And you can see in red SARS-CoV-2, and the dots and triangles indicate cases of respiratory infections, some of them confirmed by swabs. So in the nursing home, an outbreak occurred in February 2024, and we also found a lot of viruses in sewages, and in the same period also in the sewages of Pisa. Then a new SARS-CoV-2 circulation of SARS viruses we detected in nursing home without cases, confirmed cases. The higher viral and case detection in nursing home indicates that besides the vaccination, non-pharmaceutical prevention measures should be adopted. About prison, the results are quite different, because just one outbreak we detected in December 2023, nothing more later. In the same period, we have found also SARS-CoV-2 in sewages of Lucca, but no more in the prison. This lower viral detection in prison can be explained by the lower contact rate with the external population. So some key message of this first project. In individual community, the wastewater-based epidemiology confirms the added value of showing the viral circulation even in the absence of clinical cases, and the viral detection at the city level confirms the viral circulation in the corresponding communities. We have found just SARS-CoV-2 and adenoviruses, but no other viruses, and this can be correlated with some problems, some challenges that wastewater-based epidemiology has. So methods, for example, sampling, concentration, detection, and data normalization, and also the characteristics of the sewage system, and this enters in the project of the Professor Claudio Lubello that will continue. Thank you.
Thank you, Anna Laura. Oh. So, we understand that we are measuring, first of all, concentration of wastewater. Concentration of what? Of genetic footprint of microorganisms. But we have really some big problem. For instance, today, now, it's raining. In Tuscany and in Italy, first of all, we have combined sewer systems in which we gather together used wastewater and rainfall, for instance. So water that have not any signal of microorganisms. So if we today, now, we take a sample of wastewater, we will find a really not so heavy concentration, because there is wastewater and rainfall too. So we have to model the sewer systems. Hydrological modeling, hydraulical, modeling. And we have to understand that inside wastewater, the signal that we are trying to find, it's not the same along the sewer system, because we have the disgregate of nucleic acids. And this behavior could be represented by some mathematical model. For instance, a first-order kinetics that can represent the behavior. But it depends on several parameters, environmental parameters, such as temperature, for instance. So we have to put together all these things in order to understand what we are measuring and to predict the presence of the spread of the disease within the population. In addition, in our systems, in Tuscany, for instance, we have a pre-treatment of wastewater before entering the sewer systems. We have the septic tank. Everybody of us living here in Tuscany have a septic tank in which wastewater remain hours or several days sometimes. In this place, we have a disgregation of the nucleic acids we want to monitor. So all these things together we have to take into account, and we have monitored 7 full-scale wastewater treatment plants, 2 pilot plants, and with different size of the catchment area, coming from about 14,000 people, equivalent to 500,000, just like Florence wastewater treatment plant. Our question was, it is possible to use wastewater-based epidemiology in such kind of environment so difficult for us? And the answer is yes, it is possible. In one of our wastewater treatment plants, you can see in this graph that the predicted spread of COVID-19 is well represented by our model, measuring the signal inside wastewater. And we could compare this prediction with all the infected people that we had using the traditional cleaning test that we had for some years. You can see the different, they really go together with a really good correlation coefficient. In addition, we are trying to monitor the antibiotic resistance. The presence of antibiotic resistance is really important in wastewater because the sewer systems is a sort of collection of antibiotic resistance. And the wastewater treatment plant is the point of all of the wastewater go in. So the question was, is present in this situation antibiotic resistant signal? And what do the wastewater treatment plan with all the processes that are present inside? And in our monitored systems of 7 wastewater treatment plants in Tuscany, we found often the presence of antibiotic resistance. And we are now trying to understand the behavior of this antibiotic resistance presence inside the wastewater treatment train. We have a lot of processes usually present to remove pollutant, but we don't know really their effect on antibiotic resistance. And for instance, these are the first results in the San Colombano wastewater treatment plant, which is the treatment plant of Florence. And we have, you see, at the inlet, we have a really high number of multi-drug antibiotic resistant strains, but at the outlet, we have a less signal presence. So something happened inside the train of processes, and we are comparing the different kind of processes, monitoring different plants, Tuscany plants, and to find the best solutions in order to control the spread. Where the spread? In the Arno River. The Arno River, inside ecological places in which antibiotic resistance could be present and spread all over the places and inside the population that use that wastewater. So, thank you very much for your attention.